Oh, we've learned a lot. There have been thousands and thousands of papers in pregnancy and COVID that we've learned that the virus can affect women, that women actually get worse compared to same age non-pregnant women, again, they have more severe and critical disease and they can even die more often. We learned that the baby can be affected because the baby can be born too early if the mother is very sick, can die, can have severe consequences. I think the most important thing that we've learned is that pregnant women, therefore, should be even more than other adults. There are risks more than other people. They should be on the top of the pyramid to get the vaccine sooner than other people and be protected. And it should be sold, like Asma said, in terms of protecting not only them, because they don't care about themselves that much, but they care a lot about the baby. So sell them on the fact that if they stay healthy, they can protect the baby and have a much healthier baby. And in fact, if you get the vaccine during pregnancy, that protection for her and the baby can last for a long time as those antibodies get transmitted in utero.
Thank you, Vincenzo. I'm going to actually ask the same question to Asma. What have we learned since the start of the pandemic?
I'm going to give you a very short answer. We should embrace technology. We could not have carried on living and communicating the way we always did without the technology. And therefore, I think for me, I learned that I should embrace the technology and get the best out of it.
Thank you. Ray.
From our perspective in Latin America, I think we have learned that we were not ready for such a pandemic and that we really needed more quality in our health services, and we need to take care of our population in order to avoid these extreme situations of more high mortality and pneumonia and things like that.
Thank you, Ray. Andrea.
Yes, we've learned a lot of things in pathophysiology, etc. But most importantly, we've learned how to cope with that, how to protect ourselves. So healthcare professionals, we've learned how to manage our patients. And now with vaccines, we have an important weapon to target this infection.
Thank you all. Excellent answers. We'll start with Ray.
I think we need to look forward at all the possible factors that may be related to adverse outcomes in our population, not only those that are clinically easy for us to measure, but all those socially implicated in a disease like this.
Okay. Thank you. Andrea?
Okay, so I think that also coming back to my former questions, I think, yes, we definitely need to know more in the long term what is going to happen, and particularly looking at vaccines. We know how to handle patients, how to manage patients, pregnant patients with COVID, with mild disease, with severe disease, etc. We don't know that much in the long term concerning the vaccine effects. At the moment, as I said, no evidence of adverse events. In the future, we don't know, but it's our job to see what may happen.
Thank you very much. Asma.
The world suffers from a huge gap in health equity, and we need to support women advocacy. We need to ensure that women's health and the health of their unborn babies are best served, whether during the pandemic or even when it's over.
Thank you. Vincenzo.
I think we need to make sure that new developments in non-pregnant adults get implemented as soon as possible in pregnant women. We saw what happened with remdesivir, with dexamethasone, with therapies that help women. Same thing with the vaccine. We can't wait weeks, months. We can even wait days. We need safety data for women, for vaccines, and for interventions. And we also need to be on the lookout for new variants, of course, and how they can affect pregnant women.
Thank you very much all. Thank you so much to our panel, to Vincenzo, to Asma, to Ray, to Andrea. We are sorry we missed Leona from this discussion, but she was very much with us and has, of course, given us a lot of contribution to the questions and answers. So I look forward very much to our next time when we can meet, perhaps in 6 months' time or 12 months' time, when we know a lot more about vaccines. Can perhaps tell us about that. Microthrombi, Vincenzo. Ray can tell us about the social demographic risk factors, and Andrea and I have been looking at the very interesting variations at the start of the pandemic between mortality ratios and actually the prevalence of the virus in the population. All these areas are still open for discussion and are going to be fascinating to understand many of the drivers underlying these differences and changes. So thank you very much, everyone. Thank you so much, Iswak, to Kate, to Nazia, to Maxine for making this possible. And I really hope this is going to be instructive for you all that are joining us for this. Thank you very much. Goodbye from me.